Hey, you guys, welcome to day 9 of our March Madness practice questions. Y'all have been doing great, and I've been loving the feedback and messages that I've received from you guys. And all of you who have started with our one-on-one sessions. I'm so excited for you. Yesterday, I have had a couple of people send me their passing scores from some of our course members. So I'm so glad that y'all have found me from various platforms. But let's get into our questions. You know, I always like to give you a disclaimer before I get started. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 and thank you for joining us. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I design courses and videos and other resources and tools to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I like to always give a disclaimer to remind you guys that there's no absolutes in medicine, right? And we treat patients on a patient by patient basis. And I design my material to assist you with the current guidelines that are on the exams. If I am just giving you information and tools for practice, I will tell you that because those guidelines can kind of vary based off of when the test has been updated. So know that when I'm doing these questions, if you kind of question it, it's because I'm doing the guidelines that are currently on the exam. I keep up with this and I provide it for you so that it can help you so that you are studying what you need to study to be successful. All right? Because that's what I do. Thank me later. But let's get into the questions. All right. Question number 1 states the nurse practitioner has carpal tunnel as a differential diagnosis for their patient. She is completing her assessment to confirm her diagnosis and is tapping on the patient's wrist at the median nerve. The patient does experience pain. Based on this information, what test was the nurse practitioner completing? Is it A, the Phelan sign, B, the Finkelstein test, C, Tunnel sign, or D, the Lockman test? Take a moment and tell me what you think in the comments. All right, you guys, I always recommend you reading the stem of the question first so that it slows you down and you are ensured to be answering what is even asking you. We can get into the scenarios, create our own storyline, and we are not answering what the question is asking. So read that stem of the question first. I know it sounds crazy, but I promise you, as you're practicing questions, if you slow yourself down and start with the stem, I guarantee you will have less, if any, careless mistakes by misreading what they're asking you in the question. Okay. So the stem of the question states, based on this information, what test was the nurse practitioner completing? All right. So let's take it back. The nurse practitioner is thinking that the patient has carpal tunnel. She's trying to confirm her differential diagnoses and she's completing her assessment. She is tapping on the patient's wrist at the median nerve, and we're trying to figure out what test is that, right? Is it A, Phelan sign? No. Although this is a test for carpal tunnel, it's not Phelan sign, right? Because Phelan sign is done by, how you bend your wrist, and you're putting the backs of both of your hands touching. And if it is a positive, if they are positive for carpal tunnel, they will have pain. So putting your hands, the backs of your hands together, folded. Is it B, the Finkelstein test? No, Finkelstein's test is used to confirm the diagnosis of the de Quervain's tenosynovitis. That's always a mouthful. But that's the exam where you have the patient to make a fist with their thumbs folded in the inside to confirm that diagnosis of the de Quervain's tenosynovitis. Is it C, Tunnel sign? Yes, it is. Tunnel, always say think tunnel and tapping. T for tunnel, T for tapping. Gonna tap on that median nerve. Remembering that with carpal tunnel, that median nerve is where that pain is, right in the middle of that patient's wrist. Tapping on it will elicit pain if it's positive. So C would confirm her diagnosis of Tunnel sign. And D, the Lockman's test, has nothing to do with carpal tunnel or the wrist. It's actually an exam for an assessment of the knee when you're thinking there may be a ACL or PCL tear, most commonly for the ACL test. Okay. All right. Let's get into question number 2. Question number 2 states, the nurse practitioner is reviewing the Dexa Scan results and the T-score is -2. Based on these results, how should the nurse practitioner diagnose? Is it A, osteoporosis, B, osteopenia, C, a normal finding, or D, systemic lupus? Tell me what you think in the comments. All right. The stem of the question states, based on these results, how should the nurse practitioner diagnose? All right. So what are we looking at? They have completed a Dexa scan. The T score results is a -2. So what diagnosis is that? This is something you need to be aware of the Dexa scan T scores and the categories it falls into. Okay. So with osteoporosis, we know that's -2.5 or below, right? And then from that -2.5 to -1 range is that osteopenia. So here, this will give you the answer of osteopenia because it's -2, right? It falls in that range. And then anywhere coming from that positive range, um, on up greater than that -1, 0, 1, 2, 3, 4, etc. is a normal bone density. Okay. So again, here -2 lets you know there's some low bone density going on, and that's B, osteopenia. If it was -2.5, we're rolling into the osteoporosis range. Okay. So just know your T scores and then knowing how we treat as well. Okay. And I do have a video on osteoporosis versus osteopenia. Go check it out. I'll break everything down and those contraindications with those treatments, etc. All right, and last but not least, let's get into question number 3 for today. It states a patient presents to the office complaining of vaginal discharge. On exam, the nurse practitioner notes a strawberry cervix. Based on these findings, how should the nurse practitioner diagnose? Is it A, bacterial vaginosis? Is it B, trichomonas? Is it C, pelvic inflammatory disease? Or is it D, cervical cancer? Take a moment and tell me what you got in the comments. Mm, mm, mm. All right, all right, all right. Stem of the question states, based on these findings, how should the nurse practitioner diagnose? So what do we have going on here? The presentation is what? And so I also want to say this really quickly because this is a diagnosis style question. And I always tell y'all to study assessment, diagnosis, evaluation, and treatment. And so you'll hear me say, like in this scenario, all right, if we're diagnosing something, we need to take it back and look at the assessment. The assessment is viewing how they present themselves, subjective, objective. So, how are they presenting? What are those signs and symptoms? What has been determined on exam when they were assessing the patient, right? So, here, because you're going back, assessment, diagnosis, evaluation, treatment, right? So, for the assessment, the patient is complaining of vaginal discharge, all right? So this is subject. This is what they're telling you is going on. And then on exam, the nurse practitioner is assessing the patient and they notice strawberry cervix. So with those findings, are there additional tests that we need to do as far as diagnostic exams? That's what you want to consider when you're thinking of diagnosis. And then your differential diagnoses, right? So here, you need to know those key identifiers. When it says strawberry cervix, you should instantly go to trichomonas. So your answer is B, trichomonas. Um, here. And so when you see me or hear me teaching these courses and going through videos, or if you've done any of my courses and I go through my spiel and go over and over and over with that assessment, diagnosis, evaluation, and treatment, this is what I'm talking about because those are the categories that they place this in. And a lot of times you're not hearing what I'm saying when I say that because it's like, all right, I'm just doing questions, but I'm trying to gear your mind so that you are studying in that fashion as you're working through. Like in my review book, that's why I break it down that way. Because if you're studying in that fashion, it's much easier to apply it in that fashion because on boards, that's how they categorize their questions and that's how they're testing you. And so if you've received feedback, if you've been unsuccessful on boards previously, you'll know exactly what I'm talking about. When they give you the breakdown, it'll give you your test score, but it'll tell you which areas that you were high in, moderate, low, etc. But it's broken down like assessment, diagnosis, evaluation, treatment. It'll say planning or implementation. But when I try to group it down into these sections so that you are making sure that you're studying it and not just saying, hey, pneumonia, treat with the macrolide. I want you to know all the steps. I want you to know the presentation of a pneumonia so that you know assessment. So the person presents complaining of a fever, sudden changes, that brownish sputum, they may be coughing up, it's a productive cough, etc. That's your assessment diagnosis. You're going to start to think of these differentials, right? Pneumonia being one of them, but we're doing those diagnostic exams. If there's gold standards of those, that falls into that category, like your chest x-ray, and how those would present. How would we evaluate based off of, as you're planning and treating, seeing if they have any allergies, knowing what if they've been on any treatment in the last 90 days, so that you know how to treat. And then actually, so that's your planning and evaluation stage. And then as far as treatment and actually implementing these things, that is what the treatment is. So you starting with that macrolide, plus amoxicillin. But what if they have an allergy to penicillin or macrolide? What would you do next? You'll go to that next line therapy with your doxycycline? Or what if they've been on the treatment in the last 90 days and we have that DRSP in place? Then you're going to go to your respiratory fluoroquinolones. You know what I'm saying? So when you study in this fashion, it is programming your mind to hit all the tiers that they're going to potentially ask you on exams. And also, if you're doing my practice questions, or you see these videos and the things, or you see how I teach, I'm teaching in those categorized sections, and you see my questions, that you may think, hey, we just did something on pneumonia, or we just did something on trick. But one, you may see that I'm testing to see if you know the presentation of trichomonas, or how you evaluate, or what the tests are, or how you treat, etc. Like I say, it's always a method to my madness. And just trying to help you prepare. And everything that I do is to strengthen that muscle memory, so that you can be successful on boards. And also, when I'm working with you guys one-on-one, or if you're taking my review courses, that's why my assignments and things are structured in a certain pattern and fashion, because I'm trying to get you right. That's all it is. So trust me with that. But as always, you guys, that was my soapbox. But make sure you like, comment, and subscribe. It helps the channel, helps me to help you guys. And be sure to share with whomever you may think may find this beneficial as well. If you know somebody that's just, looking for something to study on the go or things, that's why I try to do this stuff, because, hey, you might have this stuff, or you may not be in the season that it's time to actually start testing, or you may take a long commute and you're just trying to test and gauge your knowledge. I'm trying to give you these easy tools so that you can do it on the go as well and see where you are. Okay. So share if you know somebody that may find it beneficial, as always. But if you need us and me to assist you, a little bit more, or separately, you want to take advantage of our review courses, self-paced, or our group courses, our next 5-week intensive is coming up. You will see those things, the links out for that, to get scheduled with the early bird. And then, it'll trickle on through, as we always do with our 5-week intensive. Or if you just want to do a individual self-paced, I do have custom review programs, or one-on-one sessions that you want to do with me, Dr. Brittany. Or if you need to utilize any of our review material, like our review book and things as well, it is available as an ebook, or you can have the paperback shipped to you as well, with the breakdown in that fashion. It is colored with the images to help you with your derm section as well. There's interactive sections and practice questions in the back as well. But as always, like I tell you guys, reach out to us at the Nursing Studio. If you need us, give me a call at 803-400-6864. Or you can shoot us an email at the Nursing Studio, the number 1 at gmail.com. And we look forward to helping you be successful on boards. All right. Bye, y'all.